Hey there, it's Hoang with Hand Therapy Secrets. I wanted to share a video of me talking to an occupational therapist who is now studying to become a CHT. Her name is Kari. She's one of my students in my program, and I love talking to her because of her story as starting out as a COTA, becoming an OT, and now working towards becoming a CHT. And she has just, she's got so much spunk and so much spirit. And this is her story of living in a small town and becoming a CHT soon. So I hope you get to enjoy and listen to her story of her journey and how she's studying and preparing for the exam. Enjoy. Welcome to my show. I have not even gotten a real name for this except for it's the Hoang Show. Not the right show, but the Hoang Show. No, so cheesy.
Yeah, that's cheesy.
That's so cheesy. I've got a lot of cheesy jokes. But
I'm the queen of cheesy analogies at my work, okay? I've got them. I've got little one-liners for everything.
That's awesome. Me too. I love when I'm working out here, making cracks and jokes, and Claudia's eyes are rolling back behind her head.
Okay, so we use beans at work. I know this sounds so crazy, but flutotherapy? Flutotherapy is super expensive. You cannot reproduce it at home. It just doesn't work like that.
Mm-hmm.
And so when you're trying to reproduce these things at home, you want something that's easy and cheap. So what you do is you tell the patients, go get beans. And I always tell them, you only want 239. You don't want it to be too farty.
You're so funny.
I know. Stupid one-liner.
Stupid one-liner. So I wanted you to come on the show as, so you are in my hand therapy exam program, and we can talk about that later, but I wanted you to come on because you were telling me a little bit about your history and your story and how you got into hand therapy, and I really love it because I think a lot of people who start out as COTA, you started as a COTA, I think sometimes they feel like they can't do more in their career, and I think that COTAs have every possibility to do more, just like occupational therapists have every possibility to do more, and it just depends on what they want and how hard they're willing to work for it, right? So tell us a little bit about your story in hand therapy.
Honestly, my drive for medical stuff started when I was about 13 or 14, and I became an EMT basic on National Ski Patrol. And you would be surprised how much of that plays into effect even in clinic, like when somebody starts to pass out on you because they see you unwrapping their surgical wounds and they get that hot flash and they start to go vasovagal on you, you'd be really surprised. But that is where my original love for all of that went. So I started out in National Ski Patrol, and that's where I realized I wanted to be in the medical field. And then when I got out of the military, I wanted to go into the medical. Yes, I was in the military.
Which branch?
I was in the Army.
Okay.
And so when I got out of there, I wanted to go into the medical field, but I didn't really know what. And believe it or not, I applied for a PTA program because there was a PTA program nearby. And my husband at the time, he's like, hey, check this out. I think you would like it. And I watched some stuff online, and you know how you have to go through and do the volunteer stuff to see if you like it. And I'm sitting there going, this is boring as hell. I'm never going to survive school. What is she doing? Because that looks fun.
Yeah.
And believe it or not, what got me into occupational therapy was an occupational therapist making a treatment plan out of a pediatric patient wrapping a vacuum cord around the vacuum using range of motion and basically, and I learned from that, being able to use anything to make a treatment plan. And I should be able to open that drawer and be like, here's what you got, make something happen.
You're like the MacGyver of occupational therapy, right? That's how I think of it sometimes.
No, it totally
Did I just
is.
show my age? Do people know who MacGyver is?
I totally do, and I used to watch that show all the time.
My staff don't. They're like, who's the MacGyver?
I'm with you, okay? We're on it.
Thank you.
And so I reapplied then to COTA program, and I got into that one. So I switched over from PTA to COTA and never looked back.
Good for you. And then how did you decide to go into occupational therapy? Because that's a big jump from the COTA program into the OT program, right?
Well, it's one of those, like, I kind of do everything the long way around, I guess, because I always wanted, you know, when I was first watching how they do things and what I thought OT was, I was watching and it was somebody working with hands at a hand table. And I was like, that's cool. I want to do that.
Yeah.
And so I always wanted to get into hands, but as a COTA, it was very challenging to get into hands. Not that I didn't work in hands as a COTA. I did at Fort Hood. I worked on the military base with some hands. I worked around in clean, doing some hands and pediatrics. So I did a little bit, but it was really hard to get full time in there. And the other thing is that it's really hard to get, if you get certified or get your CHT, it doesn't transfer into your OTR. So it doesn't make sense to get your CHT because then it stays at an OTA level. So
I don't think you
can now. I think you were able to at one point, but I'm not sure you can.
Yeah, because COTAs ask me all the time if they can become a certified hand therapist, but I don't think so, because
I don't think you can anymore.
So much about becoming a certified hand therapist as that specialty is the evaluations.
Exactly. So I just
like, screw that. I want to be able to do what I want to be able to do. Like, I see that, like, you're like, nothing's stopping me.
Well, actually, as a COTA, I lost jobs because I worked in a small clinic. It was me and an OT, and the OT quit and moved. We were in a military town. She got PCS.
Oh, yeah.
She moved away, and I lost my job because there was no OT, and they couldn't find a traveling therapist to fill in.
Wow. Yeah.
So I'm like, you know what? And then I ended up being a single mom, and I'm like, this is not acceptable, relying on somebody else's license to be able to sustain my family. So
right. Yeah. Good for you. So you went to,
fine.
And now you're on the road to becoming a certified hand therapist.
When I did my internships with my OT degree, I approached the people here in town, and I was like, hi, I'm Kari, and I've been a COTA in occupational therapy for 12 or so years, and I'm going to come work for you, and I'm going to be an intern. And I just was a thorn in their side and never left. I just kind of hung around. I literally just kind of hung around until they finally gave me a full-time job.
Good for you. Yeah. I always say that. It's about persistence. People who have applied multiple times to my clinic are the ones that actually eventually get in.
Exactly.
But yeah, it takes persistence. So not letting no be the thing that stops you.
Exactly. And I knew that I did a bridging program, and that's the other thing, which is kind of crazy because they're opening an OT school less than an hour away from me. I flew to Denton, Texas from Montrose, Colorado once a month for 3 freaking years.
Wow.
Tell me that doesn't add to your student loans.
It really does. When I was teaching at Barry University, they have the weekend program. So there was somebody flying from Seattle to Miami to go into that program. And I was like, what are you doing? She goes, no, because she was taking my kinesiology course that if she passes, she would get in. That was the one class she was missing. And so I was teaching that critical class where if they made it, they got into the program. If they didn't make it through that class, then their admission was revoked because they needed that one class. I know it's terrible, but I didn't make it hard. It's just like, you just have to know your, kinesiology stuff. but but she was doing that for that whole summer. For the 2 or 3 months, she was flying back and forth every other weekend. But then once she got in, she was going to move to Miami for the duration. But a lot of times people are flying in and out, So, but you did it, and
yeah, they discontinued the bridging program, or at least that one. But every single person in my class flew in except one person.
Wow, that's crazy.
It was. But you know what? I learned more probably from the students in my OT class, as maybe not more, but just as much as I did from the professors, because we had COTA professors in my OT class.
Wow.
And yeah, we had people that, like all the different certifications at some point, like when they were teaching somebody was like, oh, I'm certified in that. Let me give you a quick demonstration.
Okay. Good.
So, and our class was literally split like 50% adults and 50% peds. And so it was a lot of fun.
Cool. That sounds really awesome. So tell me a little bit, share your story about your road to becoming a certified hand therapist. What have you done since you got your OT license? You started working in hands, and you have to wait your 3 years. You have your hours. Now,
well, like I said, I was just so I live in a small town, and I worked for one of the clinics that I internshipped with, and I literally, when I first got done with my OT program, I was working like 6 different jobs PRN. And if they called me, I would cancel on somebody else in a heartbeat. I'd be like, I'm sorry, I can't come in. Oh yeah, I'm free that day. Of course I'm free.
Yeah.
So I have been incredibly fortunate. Like the gentleman that started the clinic that I work at ended up passing away from cancer, and he trained 2 absolutely amazing hand therapists that have been very instrumental in mentoring me. They are always available to answer questions and explain things. And we have weekly meetings. We have like a monthly or twice a month meeting with the doctor, our referring hand surgeon, where we can ask him questions like, hey, when you got in there, what did you see on this patient? This is what I thought was going on. What did it actually look like when you were in there? And so we have a really tight knit group that we work with. And I think that has been really instrumental, because you need to have those people that you can rely on. You need to have those people that you can ask questions to. Like, there's book learning, which is great, but book learning doesn't do everything.
Sure.
You need the other side of it. You need the the real life stuff.
Yeah, but a lot of people still can't get that. A lot of people still can't get access to that, which is like the whole reason why I started the hand therapy mentorship program. But that's like a whole nother,
No, you're absolutely right. You're absolutely right. And it's really hard. And as a COTA, it was even harder to get in, because you don't have the same, you don't have the evaluations and the skill set and stuff like that. But, being in the smaller town, we see a lot. And I mean, we get everything like, hollow points to the hand, to lacerations, to
it's always small towns, man. They get the worst cases. All the crazy stuff you be doing in there.
Well, we got to make stuff run around here.
I know. Got to cut some trees. Get some wood for the fire.
Hey, I've literally had patients like, I was putting wood in the fire and I burnt up my splint because it went flying off.
I'm telling you, I'm not making this shit up. Like, I know this is like, you guys do some stuff up there, and
I know.
We just go to the store in the big city.
No. We have our patients in the wintertime, they bring their ski poles with them so that we can make their splints accordingly. Because,
that's incredible. I love that.
And we also have
in
my clinic, we have a professional bike fitter in our clinic. And so we have like, I have made splints on bikes. I'm like, okay, somebody come hold the front of this bike. I'm going to put a glove on. We use Delta cast. I love Delta cast way better than thermoplast. And so I'll wrap the handlebars in Delta cast or go get some saran wrap out of the kitchen. I'm like, okay, get up here. I'm going to wrap this sucker up. And when I tell you, get on your bike, like you're riding it.
That's awesome. But like, that's so occupation based. I mean,
okay.
You know, like I hardly ever use those words, but you know, come on.
Small town. The gentleman, Gary Krabby was his name. He actually had somebody bring in a colt into the clinic so that they could wrap it, so that they could fix its leg, because
oh my gosh,
cat. So we've had to bring in their musical instruments. I mean, just anything.
I splinted a dog's leg.
No, and I have a patient next week. She's bringing in our keyboard.
Yeah.
You know.
That's great. That's awesome. That's so cool. So you have all this help to become a great certified hand therapist. Let me ask you, what drew you to do the program then? Because I think some people want to do the hand exam prep program because they don't have like mentorship or help.
And I think that that's very important what you're saying. Like, I think you need to know your learning style. And I know my learning style because I'm very dyslexic. I made it through my COTA, my bachelor's degree. I made it through a lot of stuff without even being diagnosed, without even having special accommodations. Literally, the only special accommodations I ever got in my COTA program was my national exam. That was the only thing I ever got. So I know that I need to be able to talk and communicate. I need to be able to listen. I'm not a book learner. I don't learn out of the book. I don't learn by reading it out of the book. I learn by listening and talking. So I like the Cliff Note version that you give out of the book.
I love that. I'm going to start using it. I actually started using that because I think it was you.
No, it is so true. You take this book that's this big and you take it down to the Cliff Note version, and then you tell me the Cliff Note version, and then I can write some notes on that. That's the way my brain works.
Yeah.
I know my brain, and I have always partnered with people that I study well with. And I have always partnered with people that are learners that learn well out of the book. And they will teach me what they learn out of the book, and I'll teach them what they missed out of class.
Yeah. Yeah.
That's just the way I am.
That's awesome.
So,
that.
I don't know. It's just the way it is. You need to know yourself, and you need to know what works for you. And I knew going into this that just getting the online stuff with the videos and stuff like that, like I can't ask questions. You know, with this whole Corona thing, this will bring it into perspective. My daughter, everybody got homeschooled. I watched my daughter do her homeschooling lesson. They gave them an app. She sat down for 30 minutes and did 2 math problems. And I didn't help her because I wanted to see how she was doing with this. And she would click on the replay and get help. And then she put in the answer and she didn't get it. So she clicked the replay and it would say it in the exact same way. It didn't tailor it to what she wasn't understanding. It just repeated it exactly the same way.
Yeah.
Well, you need it worded different. And just like when you're talking to your patients, you talk differently to your patients. You talk
to different people.
If you have a medical professional coming in, you're going to use medical professional words. If I have a mechanic coming in, I'm going to talk to him like a mechanic because I use analogies for everything. I'm a visual learner, so I will talk to him about how the electricity runs and when you're rewiring a trailer and you're rewiring trailer lights, and how an EMG is the same thing that you use when you're checking your trailer lights. And he's like, oh, I know what that is.
I get that because you related it to him. Yeah.
And so I know what I need, and that's the reason why I sought it out. And that's the reason why I knew the program itself would work for me, because that's what I need.
Yeah.
Not everybody needs that.
Not everyone needs that.
If you don't need it, you don't need it. Good for
That's
you.
right. Yeah.
But if
And
you
has it been helpful? Has it been helpful?
Oh, absolutely. And I think a lot of it, the calls are really helpful. And as you know, I'm your stepchild. I ask 1,000 questions.
I want questions.
Because if you don't speak out, if you don't ask questions, you don't learn. Because it's just like the computer hitting the replay button on my daughter's homework.
Right.
If you don't ask questions and get it told to you in a different way where you understand it, it doesn't do you any good, and you're wasting your money. So don't buy it if you're going to be too shy to ask questions.
Yeah. Well, that's why the shy ones rely on people that's brave like you, Kari, because not everyone asks questions. And because I belong to different programs, sometimes I don't ask questions and sometimes I do. But I do rely on, I learned so much from listening to other people's questions. And I think a lot of people in that program really benefited from the fact that you would come on and ask questions. And they got to sit there and listen and learn from how you were asking the questions, because they had questions they just didn't know that was a question they had. So I think it's both, people who come on and they know they have questions, they want to ask it. And then there's other people, they're not really sure what the questions, and they get to learn. They're like, oh yeah. And that actually, what's funny is that will actually fire off questions, because I'll get emails after that. So then I'll be able to answer those questions, or I'll be able to answer on the next call. So
yeah, that's very true. I get that, but I'm just, take advantage of it. Don't be shy.
Thank you. Say that again. Take advantage of it. Don't be shy. That's why that program is there. And that's why that program is so powerful,
Yeah.
And I think
it only works if you work it, and that's how it works.
Yeah.
So if you want to, and I wasn't always I was always obnoxious, but not always so much to be in the front of class and being obnoxious. I learned developed. We absolutely. You know what? I learned it in my COTA class. I learned that these are the same people that I sit with in class every day, and they're the same ones that are staring back at me when I'm standing up giving a presentation. So they know just as much as I do. So who cares?
Yeah, exactly. Well, I thank you so much for joining me on this Hoang show. I gotta get a name for this.
You've got to come up with a name. I gotta
come up with a name with this. But I think you can help me with that. But
Hoang hand.
Yeah. The Hoang hand. Oh my God. Kari.
Yeah. The Hoang hand.
Your one-liners.
I told you the punny one-liners.
I might use that, Kari. I might use that.
Hoang hand.
The Hoang hand. Oh, I love it.
See, I know it's cheesy as hell, but
I love
people remember that stupid stuff and they think it's funny. And you know what? Unless you've been there every day and you hear me say the same one-liners all the time, they laugh the first time they hear it every time.
It's my same joke. It's my same joke, different people.
I know, it's exactly true. And they always laugh. And my tech that sits behind me, he's like, he just sits back there and shakes his head. He's like, seriously, again? I'm like, yeah, but they laughed.
Claudia,
and now we have this relationship going because now they think I'm funny. And now we have this rapport and we're laughing and joking and they're not thinking about their hurting hand. And now I can poke at them a little more. And so,
that's
see?
Awesome. That's awesome.
My stupid one-liners.
Yes, I enjoy it. Well, thank you so much for sharing your story, sharing your journey, and I'm really excited to be part of it. Thank you, Kari. I enjoy it.
Have a good one.
See you on a call. All right.
All right. Talk to you later.
Bye.
Bye.